So I'm honored to be asked to welcome you to this year's 2015 conference. Since 2012, I've enjoyed the honor of leading OneCare Vermont since its inception. It's allowed me to understand deeply how Vermont has more puzzle pieces and the right puzzle pieces to really raise the bar on how good a healthcare system can really be in service to its patients and population. We stand today at the precipice of putting the full jigsaw puzzle together, better than anywhere in the country.
So let's talk about the VHI, your VHI, the Vermont Health Information Exchange, something we have been collectively working on for 10 years. It's a long time. A lot of funding has gone to it. I can tell you that after interacting with a number of my fellow HIEs about 3 weeks ago, that we are significantly ahead of many, many other regions and states around the country. It is a tough go. So ensuring that data is high quality is absolutely paramount to success. And we've been approaching that sort of in three ways. One is at the source where the data is predominantly entered. Secondly, at the network level where we have the data aggregated. And third, to provide a feedback loop back to the source organizations regarding progress towards improving clinical data.
Now I get to do the coolest thing today, which is introduce the Chief Science Officer of something. When I saw that in my notes last night, I was like, Spock! I never in my life thought I would be able to introduce a Chief Science Officer, but it's my pleasure today to introduce Dr. Shahram Ebadalahi, who is going to wow you with how smart he is. He is every single thing I'm not. There's never been a greater gap between the presenter and the person introducing the presenter in terms of IQ in the history of Vermont.
Actually, one of the reasons when I was contacted back in summer and told about this event and happily accepted was because I knew of the great work that everyone here from VITL, Blueprint, and State are doing, and everyone in the country and across other nations as well, aspiring to do the same thing.
And I'm curious about whether you're seeing any really new things or trying any really new things about not just perhaps engaging patients the first time, but re-engaging them when they fall off the wagons.
As I said earlier, this issue of engagement and also behavior modification is key to the success here.
Has there been any talk about the whole issue of it's great that we grant patients access, but we can't force them to actually go in and use the system?
To meet those types of measures, I have staff people who are constantly engaging patients to, first of all, get them signed up for the portal, and then constantly engaging them to use the portal. And we have found that once we get people to kind of break the ice and use the portal, they get a little more used to it, and they do use it.
Some of the things I can say from working in the field, the practices that we're working with at VITL that we found are successful in implementing their portals and getting their patients actually engaged using their portals, the strongest message gets delivered not from the peripheral staff that's saying, do you want to sign up, do you want to sign up? The strongest message comes when that patient's in the room with the provider and the provider says, hey, if you want to get a hold of me, send me a message through the portal, I'll get it. Here's how you sign up.
So I'm from Dartmouth Hitchcock Medical Center, and when I began to ponder the question, how has data transformed your organization, I thought to myself, well, actually our organization is 123 years old, and data has been used for studies and research for all those 100 years, right? And so then I thought maybe the question really is, how has technology transformed the way we use data so that we can have faster change to healthcare?
So if you know where you want to go with your company, that's your compass heading. Everything else comes down from that. How do I get there? Do I need another person or not? Does it get me there? And then like, what have you got? What do you need? All those kind of questions start to fall in. When is it time to ship? When it gets me there. What I see a lot of people do is they forget to really get a good picture in their mind of what that looks like.
Mm-hmm. The face of healthcare itself, in my experience, has changed drastically in just a short time since my diagnosis. I've also noticed how medical facilities are making it easier to communicate, for me to communicate with my providers and also to access my own medical information. I'm discovering more providers active on social media, whether to take part in conversations and answer questions or simply stay current on the issues that their patients face. In this age of technology that we've found ourselves in, it's so important, albeit somewhat difficult and time-consuming, for providers to take advantage of technology and use it to help their patients get and stay healthier.